6.
Yes.
It is known that there is a negative relationship between school achievement and days absent from school. People who miss more days of school are likely to have lower GPAs. Which of the following graphs represent the relationship?
Thank you. Negative relationship. Let me answer this question more generally. When you study statistics in depth, but we don't need for this class, we consider a few different scenarios and we count this correlation coefficient. We don't need for this class. We have few options. Let's say we have, there is impossible to measure exactly. When you make experiment, I make few graphs. Few cases, right? If I need, I add more. Let's say you have some data, right? And you build the best fit line. And first of all, this points very close to this line, and line goes up. So slope is positive. And since point of this measurement very close to this graph, there's a strong positive correlation. If I make another cell, let's say put some graph like this point. Okay. It's also positive. But points pretty distant from this. This is weak positive correlation. And if you have point like this, no correlations. You can make this best fit line. And we have another cases. If you have graph like this, and your point goes like this, there's a strong negative. Why? Because slope is less than 0. Negative. You don't get this question. They ask you which one you have negative correlation. Definitely C. This is C. Why is negative? Because slope is negative and point very close to best fit line. You can have like this negative also, but it would be weak. This is weak negative correlation. Who understand this? Who has questions? No questions. By the way, students, you think that your measurement of what you study is for SAT? No way. I use this statistics tools for one of our project, our invention for cancer diagnostic. Yes, based on these graphs. If you're interested, I can show a few slides after the class, not right now. Who would like to see how to use this approach for cancer diagnostic? Okay, stay after class. Few minutes, I show this, right? What we did, we name it blood cell morphometric method. We study lymphocytes to blood smear, but I'll tell you later, okay? Let's continue. Everything you study extremely important in your future career, 100%. It's not SAT. Well, students, can you see my screen right now?
Yes.
Yeah.
Okay. Again, I have 13 corporations. This is one education where we study with you, and the smartest kids become the smartest students. And after that, many of my former students, they were all over the world, the head of institutes, labs, etc., etc. And this is one of my projects, was done in American Medical Technologies Corporation, right, a while ago. And I want to show how it works. This is cancer diagnostic, blood cell morphometric method. This method, I will not go in all the details, but it was great. I knew him personally, Valentin Gavala. He created this book. He wrote this book about immunology, and he started studying lymphocytes. And he found that lymphocytes has different morphometry, different shapes, depending how people are, let's say, sick in this book. And after that, he developed a simple way. We use special program, this robotic microscope. I don't know, you see my microscope or not. A robotic microscope, very expensive, like it has special movement, XY coordinate. You put blood smear, put here on the table, and microscope microscanning all this and finding this all lymphocytes. It's recognized lymphocytes, special program written in my corporation. We measure all these lymphocytes, but measure is not enough. Let me return to this, right? And based on morphometry of these lymphocytes, we can answer the question: does patient have cancer? Yes or no? If he has, how advanced is this disease? Even using blood smear, drop of blood, we could also answer where is it localized, where is location, and how strong is defense if this person does not have cancer. If he approaching to this, or he is pretty far from this. So I'll skip all these diagrams. I want to show some correlation stuff. Okay, this is cancer. I want to talk. This is math class, right? We're not talking to doctors. Okay, this is great topic. I want to show you this. So I did it together with great person, Dr. Evgenia Skybeltsin from Kharkov, Ukraine. We are friends for many years, and this method we developed together with him. We created a special program, right, with both of us. And after that, we started this method in different countries, and this is how it looked like. If you blood, what is blood smear? You have a glass, and you put a drop of blood on this glass, and after that, using special colors, you make some stain for this, right? And put on the microscope. You see this? There are different we have erythrocytes, lymphocytes, etc. Different in this microscope. Now, pretend this is lymphocytes, schematically. So this is cell, and this is, okay, nucleus of this cell. And we measure all these parameters like oval or an oval. And based on this, now we can recognize we have regression lines where we have X-coordinate diameters of lymphocytes, okay, and nuclear cell ratio. What is nuclear cell ratio? Is the ratio of area of cell to nuclear. If you return to this area of this big oval to this small one. And we build different graphs for a different category of people, okay? And after that, definitely our point does not belong, they don't belong to this graph. You use method of approximation, and we build a best fit line for this based on this measurement. And after that, based on this parameter, we could answer a lot of questions, even localization of cancer. Can you believe just drop and you can say, well, this person unfortunately has lung cancer, and etc., etc. So I want to emphasize that studying SAT is not SAT, it's future of development of different measurement. Can a regular doctor create this method? What do you think? Soon, question for you. Can ordinary doctor create this method?
No.
No way. They have zero preparation. They have zero knowledge. They don't study geometry. They say geometry is for Archimedes. No, everything based on geometry. Only combination of different knowledge can we help with this, right? Or for some doctor give some stuff formula, he said, wow, it's too difficult. No, everything based on math. You can find any project, real project, any development which does not go. I am not going to analyze this course. This is special course of this. This is our patterns. But this is BCMM, blood cell morphometric method. And this morphology. Morphology, what is morphology? Study form. And you see the shape of lymphocyte. And this is dark is his nucleus of these lymphocytes. And this is our lab, right? This robotic microscope is pretty expensive. It's expensive stuff, but more expensive is our program which we created. Okay, we said we had this in different countries, right? It's one fragment of this. And everything based off, if you study computer, who study programming? Anybody raise hand? Okay. We use idea of programming web services, right? When doctors send you information from blood smears, and our robotic microscope, very strong computers, can analyze it and get conclusion. And this is okay. And this is different stuff. This some joke I have here. I don't remember what kind of joke. Okay, wow. Kima. No, how much it is. So this is not about this. Question about this curve. So whatever we did here in SAT, best fit line, correlation coefficient, we use this only in depth. We use special formula. Everywhere formula in graphs, formula in graphs. So far so good. And this is definitely great scientist from Kharkov Institute. We have been friends for many years. It's here. Memory, unfortunately, she passed away a couple of years ago. And last year she lived in Germany, and we contacted with her. Okay, and this myself, I teach you right now how to be smart. I'm just kidding. Okay, so again, whatever you study, this is basic of your profession. So think from this perspective. Any question about this presentation? No questions. Okay, if you don't have any questions, this is about it. We send you projects. Look at this, which your peers, kids from this same 9 and the 11th grade, who created this stuff, right? Who created this, how to say? Yes, they created this project actually. And you see quality and how smart they are, how they answer these questions, they prepared. And now all these kids would be involved in second part, in business part. And when they go to these colleges, they definitely have a lot of advantages, a lot of advantage. In last part of my presentation, I explained how colleges select you, how they give preference for you, what you're supposed to know, better if you know this advance. Okay, so far so good. No questions, students? Okay. If you don't have any questions, if you take classes of statistics, I show how to build all these different relationships to analyze graphs. Well, students, have a nice day. Be strong, be well. I don't know if you see me or not, but imagine.
Okay.
Okay, if you don't have any questions. Study strong. Okay, good. Enjoy math. Bye.